Good afternoon. My name is Emily Halowinski, and I'm here to provide you with an in-service on the high-risk stroke survivor and how we manage their care at DRHA. The intention of my in-service is to educate you, as an interprofessional group of learners, on the high-risk stroke patient that you will at some point on the care continuum be tasked with caring for. My intent is to educate you on performing the appropriate recognition, assessment, and management of the high-risk stroke patient, and that you will gain foundational knowledge to prepare you to recognize the symptoms, address risk factors, and provide evidence-based holistic care for our stroke patients. In reality, you'll need to use this information contained in this in-service in some hands-on application and practice to obtain the maximum benefits, but I'll provide you with some starter tools, if you will. By the end of the presentation, attendees will be able to apply this knowledge to improve patient outcomes and satisfaction, reduce morbidity and mortality for these stroke survivors, improve care coordination, and reduce risk to provide health promotion. First, let's talk about the patient population. Stroke is often confused with being a neurological condition, but is actually classified as a cardiovascular disease or event. Stroke is defined by Mass and Sadif as a sudden loss of neurological function resulting from focal disturbance of cerebral blood flow due to ischemia or hemorrhage. Each year, there's about 130,000 deaths in the United States associated with stroke events, making it the 5th leading cause of death in the US behind cardiovascular disease, cancer, respiratory infections, and accidents. Stroke also leaves behind quite a wake in its path, with nearly 700,000 stroke events in the US each year. Over 70% of them are first strokes, and nearly 30% are recurrent strokes. Nearly half of those 700,000 stroke survivors every year are left with some level of disability or impairment. Our best prevention or best treatment is still prevention. As I mentioned earlier, strokes are the result of vascular disease.